Hello, my name is Brian. My disorder is schizophrenia, and it's a disorder of the brain. It's a pretty common long-term mental disorder. It involves a lot of distress and disability to the individual, and it goes into this category of a psychotic disorder. The development of schizophrenia is pretty limited to my understanding. We don't know a specific cause, but we do know that genetics and environmental factors play a huge role in these abnormalities that happen in the brain. Like I said, even though there's not a specific cause, there is certain things in these patients with schizophrenia that play a role in how we think the disorder develops. One specific cause is associated with these fluid-filled structures that are in the brain. And these fluid-filled structures appear to be larger than normal. And this is caused because the patients with schizophrenia actually have a reduction in the size of their brain tissue. It is also known that the cerebral cortex appears to be smaller, has a decreased size, it appears to be thinner, and it's thinner in parts of the frontal lobe and the temporal lobe of the brain. And these parts, as we know, have a lot to do with the cognitive and perceptual functions that are often abnormal in schizophrenia. There is also another development of schizophrenia that we think happens to do with the high levels of the neurotransmitter dopamine. This neurotransmitter dopamine appears to be high in certain parts of the brain of these patients of schizophrenia. So basically, I'm saying that these patients who develop schizophrenia, something abnormally happens to their brain during the development of their brain. And more specifically, the frontal lobe and temporal lobe do not develop normally, and this leads to the disease. Some of the symptoms of schizophrenia, they're split into a few categories. The cognitive symptoms of schizophrenia, which are abnormalities of attention, organization, and things like their planning ability is not very well. And some of the negative symptoms involve blunted emotions or loss of enjoyment in activities. And then I go back to, like I said earlier, it's a psychotic disorder. So some of the psychosis symptoms, which are abnormal perceptions of like reality. So these psychosis symptoms are hallucinations, such as hearing or seeing things that aren't actually there, or delusions. Delusions are like fixed false beliefs. And unfortunately, schizophrenia requires a lifelong treatment. The main treatments involve medications, psychological therapy, and rehab. These treatments help manage the condition of schizophrenia. Medication plays a pretty big part in this treatment because there's a antipsychotic medication that helps control the levels of dopamine. And the psychological therapy is there to help normalize their thought patterns and help them learn how to cope with all this stress that they're dealing with. And the rehab portion of this treatment is that it focuses on them to help them prepare for and find and keep their jobs. Thank you.